Hello everyone. I am Dr. Sulochana Gurung, your dentist, and I am here today with another episode of Tooth Talk Thursday. Hope we all are having a wonderful Thursday. I know I got off a little late today, so yeah, coming live right now. So before we can start, if you guys can do me a huge favor and share where you are watching me from, what part of the town you're watching me from. That way I can say, like, I see that you guys, I, s- I know that you guys are here. So, uh, so I would like to share a little bit about our practice again. As you all know, we are a brand new dental office trying to make it a boutique practice here located in 8710 Northern Boulevard, Jackson Heights, Queens, New York. And our goal is to serve our community, treat our patients with exceptional dentistry using top of line technologies that is backed by research and the scientific evidence. So, and of course, creating beautiful smiles that is best suited to your personality and your need. So, um, I touched base a little bit about on smile designing last week, and I received a lot of questions from you guys about smile designing. What is it, and what is the process like, and who gets smile design, right? So stay tuned to learn more. Okay. Yeah. Hi guys. Oh, thanks for tuning in. Um, So if you have any questions during the video, you can write them at the comment section below and I'll address them as they come. So not everyone's teeth are made same way, right? So they all have different unique characteristics, features. Each tooth, each tooth in the jaw has its specific characters depending on its function, its position. You know, the right side is different than the left side. From the left side, upper is different from the lower, and front is different from the back. So, um, smile designing involves creating that harmonious balance of all this, including tooth size, jaw shape, jaw size, shape, colors, characters. So there are different face types, tooth types. Face types involve like tooth types are different too. Like people have different tooth types. Like they have squarish, triangular, pear shape, round, oval, or they have different varying colors. Some are darker, lighter, versus like some are more pearlescent, some are translucent. So yeah, those are like uh, colors, and then sizes. Again, some are smaller, some are larger, so depending on the jaw size. On that note, so some conditions can be like, there can be the tooth size can be excess. That means, as the tooth name suggests. So what happens when the tooth is smaller, when the jaw is smaller and there are a lot of like big size tooth, so that's called like that's a little, there's a little discrepancy in the jaw size and the tooth size, so that's when it appears a little crowded. Some conditions when the jaw has more space, like when the teeth are smaller, so you can see those gaps, and as I mentioned in the last video. So yeah, nature has created all of us in different proportions, right? So that appears, different proportions appear, you know, beautiful to our eyes in different, like um, in different views, or like certain objects or certain things in nature appear beautiful, whereas certain proportions are not. So it's there's a varying degree that are pleasing to our eyes. So certain proportions appear aesthetically pleasing to our eyes, like I mentioned, and that's why we try to create the same in dentistry that's closer to nature, and that's what will appear closer, like pleasing to our eyes. So some of the proportions considered in dentistry are, we talk a lot about like red proportion, golden proportion. So those are something that's considered in the it talks a little about like how the front teeth appears, how the back teeth should appear, or the central from the lateral should appear. So when we design smiles, so all of this are considered, like taken into consideration when we work on the designing part. So while smile designing, we consider criteria that involves the tooth shape, like I mentioned, shapes, tooth position, like sometimes the teeth are positioned at an angle, or that's how, like normally we call, oh, that tooth is crooked, but that's, that's like in dental terms we say like the position or the ideal tooth size. So some, like I mentioned earlier, that some are larger, some are smaller, so we closely look at those. The other important feature is the lip line, lip line. So, some of us, like when we smile, the lips are like high up. So we don't even see the teeth. So, those are some things we consider, and this is like a major factor to, like, while designing smile. And face shape, some have round face, oval, squarish. So those are, depending on the face shape too, we try to produce a smile that is more harmonious to the face. At the same time, like, we also consider like gender, personality, age of the patient. So while considering, like, while creating, while designing smile, the gingival and the periodontal health too. That means, how the teeth and gums are located in the jaw. So periodontal health of the tooth, that's it's taken into consideration as well. We try to see that the gums are healthy, the bone underneath are healthy, in order to support the design that we are creating. So tooth health, is considered as well. That's more like the teeth are, when the teeth are, some of the teeth, they are prone to caries, some are not, some are resistant to certain whitening products, some are not. So those are like a little consideration too that we consider, like, as we design smile. The other factor is caries risk analysis, which is an absolute necessity, because a lot of my patients, or like a lot of us, like, we have a lot of cavities in the mouth, but we still want to go for all those extensive restoration. So so first we try to take control of the caries in your mouth. We do a thorough risk assessments depending on the caries risk index, and then depending on the periodontal health index. So once we all calculate that biomechanical integration, that's when it will determine, like, our decision on, like, giving you the kind of restoration your smile or your mouth definitely needs. So yes, uh, yes, and like I mentioned earlier, so we consider zenith. That's the gingival. The way the smile line aligns to the gum line. So it's a very tricky situation. At the same time, it's very important when we smile, design the smile. So the gum has to follow certain curvatures, like, they have, some are like higher, some are lower. So those are very critical and specific things we take a we thoroughly, like, evaluate, study, and then try to determine where they should be. And in some cases we may have to, like, sculpt the gum. That means we may have to, like, use some laser or some mini surgeries in order to give that harmonious look. So lastly, I'll just, like, run through, like, give you a little rundown of the process. So the steps involved initially when you come in, we go over the medical history thoroughly. We do the dental history. So in dental history, like, what is important is, again, like, all the factors that we talked about earlier. Those are very important. If you've had something in the past, we try to evaluate those restorations and see if, that's something, what needs to be changed or what you're not happy with. So a lot of those factors, like, those minute details are considered as well. As we proceed with our exam, the first thing we do is dental radiographs, or the x-rays, and it is it's one of the diagnostic tool that helps us to see what's inside of the tooth, how your teeth health are, like, how, if your teeth are healthy or not, if there's any hidden cavities underneath, any caries, any kind of bone loss going on the bone. So it will give us an idea of how your caries risk, like how what your caries risk are like, what your periodontal risk are, right, and how they are integrating in your oral cavity. And the other, and we do a full intraoral, extraoral examination. That's all the clinical thing. We that's when we check for anything that's present inside your mouth. Um, as a part of the designing process, we take images like pictures of your teeth that will guide us with our diagnosis and determining our plan. And it also all the things, and it will also give us a tool to study and discuss the tool to study the things we discussed earlier in our that I discussed earlier with you guys. So, and these each and everything, every aspect of our like diagnostic like findings are considered, and which will help us guide in the process. So if needed, if needed, what we do is we send the smile designing, we send it to the lab. Sometimes we do take impressions that make like a little replica of your mouth, like of your teeth, upper and the lower. Or sometimes we scan it. So it all depends on what the situation is like what the uh, what the basic need would be then, and what would be feasible for you or easier to for you to do. We so once we send it to the lab, what happens is they send us back like a digital version. At the same time, we can help you. We can make templates of your smile, and we can try those meaning like we can try those. Okay, so we can try those in your doing a digital mock-up, which can be done in the picture on the computer, right? And then if you're happy with it, like if you want to like tweak something, if you want to add something, add some characteristics, or depending on what you like, what you don't like, we try to correct that and get like a get the template back from the lab, and we do surgical, we do like a mock-up that will tell us like, so when we try the smile on you, like, and again, like, and that's when it'll be your decision if you want to go for it or not. So yes, and again, it's so smile designing is not like a straightforward procedure. It involves a lot of studying, a lot of a lot of science and theories behind what we do. So again, and like I mentioned in the beginning, so every smile is different, every teeth are different, every individual is different. So again, the smile designing we do is customized to each one of each of our patients that would come through our door. So yes, and the last decision will be yours to, and again, to what to opt for. So, and again, so that way you can make that smile yours. So let's see if you have any questions, we can address that. Yeah, hi. Okay, hi guys. So, okay, so yes. So I know somebody in the past asked, I have gap in my teeth. Can I get veneers? So that's a very good question. So what I think is, I cannot just like I mentioned earlier, veneers is one of the tools to, one of the treatment options what we provide. So in order for me to like tell you, oh, veneers would be the option for you, we have to go through the process of smile designing, like I explained to you guys. I know like it sounds a lot of work, but like it's when you get it, it's very simple. You just have to like come in, take x-rays, um, pictures, we do the mock-up, and then you get to choose what you like. At the same time, like it's a lot of like science involved behind, but that's something that we take care of. So yes, veneer can be one of the options, or sometimes, people who are missing their teeth, they can get like bridges or implants. Or sometimes if there are gaps in the teeth, it can be just corrected by simple orthodontic tooth movement called Invisalign or simple braces. So, there are a lot of things involved. Again, and like I stated, it'll be specific to the tooth, to the person, and to every individual. So yes, and that's what we are aiming to do in our practice. And so guys, if you would like, you can apply for the Smile Project Smile Makeover Contest, and I think it is going to be up until end of this month. So yeah, feel free to contact us. So it was good seeing you. Thanks guys for tuning in. We will see you guys soon. Bye bye. Take care.